Probably not. But once you start to see these connections between climate change and menstrual health, you'll never think about menstrual products the same way again. Welcome to Reimagining Menstrual Health for a Climate Resilient Future. I'm Bee Brown, one of your co-hosts for today. We're going to hear from some incredible guests, and I know that you're going to leave feeling really inspired by all of the great work that is happening in this space. I know that we have folks who are joining from across the globe today. So to support any translation needs during today's webinar, we are going to be using Wordly. Wordly is an AI-generated translation software that enables translation into over 60 languages. To access Wordly, you can use the Wordly app, which is embedded in Zoom if you already have it set up, or you can access the link that's available in the chat. Once you click into the link, you'll be prompted to select the language that you would like to follow along in. You can choose to use captions or play the audio back to you. If you have any issues with Wordly, please message our colleagues Andile or Ximena or Sarah, and they will be able to help you. I now want to turn it over to Tanya Mahajan, who's the co-founder of Menstrual Health Action for Impact. Tanya is also the co-chair of RHSC's Menstrual Health Supplies Workstream. Tanya, can you briefly tell us a little bit more about why we're here today?
Thanks, Bea, for the introduction. As you mentioned, I am the co-chair for the Menstrual Health Supplies Workstream. And today we are here to listen to all of you present your work on understanding linkages between menstrual health and climate change. This is the second webinar, actually the third webinar in this series of webinars. The first one was sort of to set the foundation of the series. And the entire series is essentially to help us see how we can enable menstrual health markets across LMICs. All of the projects, including this one, have developed excellent advocacy and research resources, which hopefully will help push the market forward in low and middle income countries. Just to give a little bit of background to why this work happened in the first place. Conversations around menstrual waste management started almost even more than a decade ago, but sort of stagnated since then. The RHSC Menstrual Health Supplies Workstream hosted a webinar series on this topic actually in 2022, I believe, which delved into the problem statement across both developing and developed countries. What we heard and saw was that much of the evidence and solutions have focused on the disposal side of the issue. How do we dispose of menstrual products in a manner that doesn't harm the environment? But even that is, I would say, sparse and disaggregated. There has been a wave of sustainable product solutions in the space as a response to this problem statement. But even within that, it was clear that what was missing was a comprehensive understanding of how menstrual product supply chains interact with the climate, right from design, sourcing to distribution, use, and disposal. Everything has a climate impact. Additionally, the use of how climate change affects menstrual health of people in emergencies and vulnerable contexts was not looked at all, especially back then. So this invisible cost, has also limited the menstrual health market and the ability of donors and advocates to support this issue. So this was the context within which we included a line item in the workstream's work plan to really understand what would be the linkages between menstrual health and climate change. And so this report that C3 will be sharing today and the accompanying tools are hence crucial to facilitating future investments in menstrual health market development. This work has been possible with the support of the Climate M Initiative, Capital M Initiative of the Sanitation and Hygiene Fund, and they've supported different pieces of work that RHSC has commissioned on supporting menstrual health markets on standards, taxes, and climate change, all intended to further menstrual health markets. And with this, I'll pass it back to you, Bea, to really take us through what your findings have been and hear from some of the excellent speakers you have in the room.
Thanks so much, Tanya. We're really excited to see this type of investment in growing menstrual health markets, especially around considering climate change within the menstrual health space. So as Tanya mentioned, each of these webinars is accompanied by a product launch, and we're really excited to announce the launch of this report, The Bidirectional Impact of Climate Change and Menstrual Health. What you'll find in this report is that the report synthesizes the growing evidence that exists at this intersection, and it also includes several tools and resources that you can use in your own product design, programming, implementation, and advocacy. There's really something for everyone inside this report. We'll talk a little bit more about some of the content in the report during today's session. In the meantime, we'll add a link to download the report in the chat so that way everybody has access to that. So today we're going to be talking about the connections between menstrual health and climate change, why it matters, what we can do about it, and what systems we need for sustainability efforts to succeed. During our first segment, I'll be speaking with Megan Mukuria, who is the founder of Zana Africa Foundation, and we'll be talking about why this intersection is so important. In our second segment, my co-host Nicole Lower will be joined by Tatiana Reyes-Hove, who's the outgoing COO of the Bee Girl Foundation, and they'll be discussing some of the emerging innovations for climate-responsive menstrual health products. And then in our third segment, my co-host Nomi Fuchs will be speaking with Dr. Ayman Abdulmohsen, who's the Chief of Sexual and Reproductive Health and Rights Branch at UNFPA. Nomi and Ayman, they will be speaking about financing, policies, and systems for change. And with that, let's dive right in. Now, when we look at the menstrual health marketplace in low and middle income countries, the vast majority of menstruators who use purpose-made products are using single-use products. So globally, we see that around 250,000 tons of CO2 emissions per year are associated with single-use menstrual products. At the same time, we know that the impacts of climate change are being increasingly felt, especially in low and middle income countries. These climate impacts interrupt access to clean water, they disrupt supply chains, and they really can limit income as well as shifting menstruators' needs, choices, and preferences around menstrual health products. Menstrual health products are really distinct in that they offer an opportunity to contribute to both climate mitigation and climate adaptation efforts. So joining us today to talk about the importance of this intersection between climate change and menstrual health is Megan Mukuria, who's the founder of Zana Africa. Megan, welcome.
Hi, great to be here. Thanks, Steve.
So to start us off, can you tell us a little bit about Zana Africa and your organization's work in this space?
Sure. So Zam Africa's been around for 15 years in Nairobi, Kenya, and we leverage menstrual health as a gateway into not only comprehensive sexuality education, but also gender norms and social norms. So we have a nonprofit that deals with curriculum. We're embedding a reproductive health curriculum with life skills into the Kenyan government curriculum. And we have products starting with sanitary pads that deliver high quality, affordable products for low income consumers. We're serving about 400,000 people a month across both sides.
That's really incredible work that you're doing.
Yeah.
I'm curious to hear, from your work, what does this connection between climate change and menstrual health really look like on the ground?
Well, so I really think it's a two-way relationship. Menstrual products do contribute to climate change, not to the degree that things like single-use plastic bottles do and such. So I think we have to put it in its right place. But I think those of us who look at more matriarchal lenses and more interconnected lenses want to solve these systemic problems. And menstrual health is obviously one that we as women address and want to solve. So they do contribute to climate change to the degree that they're not always reusable or made from plastics. But then climate change also shapes what people need and are able to use or access. And climate shocks really hit basic needs hard. So they hit water scarcity or there's flooding, which makes it difficult to use reusables. It makes it difficult to access disposables. And all of those directly affect how people manage their periods.
Great. Yeah, I think that's really helpful for folks to understand, right? Is that, this impact, menstrual products aren't going to be the leading cause of greenhouse gas emissions around the world, but they are a place where we can begin to consider how to build sustainability within that product space. And I think it's so important at the same time to consider not just the kind of upstream product side, but also recognize how climate change is impacting people themselves. I'm curious, what do you think is something that people, especially people who are not as embedded in this space and aren't thinking about climate change and menstruation on a regular basis, what's something that they tend to overlook about this issue?
Well, I mean, maybe two things. I mean, I think one is that it's a very complex thing to try to solve holistically, right? When we started to choose making and selling single-use disposable products, it's because when we asked women and girls all across the country in markets, what do they want? They wanted a single-use disposable product. Why? Because they're often in water-scarce areas. Washing is very much of a problem for many people. And the consumerism of the world makes them aspirational as well. And so we decided to start with that product and then innovate towards other products through a trusted brand. So you're dealing with the plastic disposal, and that's a challenge. But then there are bioplastics that are available, but they're too expensive for the mass market, right? And some of them are also, for example, if you're using corn or potatoes, these can be grown and turned into bioplastics, but then they can compete with food. So then they create food scarcity. So the challenge of the actual product itself comes with trade-offs. There's no silver bullet. There's no one perfect solution. But what we have found is that when you have a trusted relationship with people, it opens them up to a variety of products. And having product diversification actually makes you more resilient. If you're able to use disposables and a cup and reusables, then whatever your situation is, you can usually, deal with that a bit better. But also then what I think that I take as so obvious, which isn't, is that when you lack menstrual products, especially as a girl or a younger woman, it makes you incredibly vulnerable to sexual predation, to having to exchange sex for commodities, including sanitary pads. And while you can maybe go for a couple of days without food and still be okay, you can't not manage your period without something. And if you're using something terribly unhygienic, you're going to get urinary tract infections, yeast infections. They might lead to kidney infections. So now you have very high cost of medical care or a very huge disease burden that might lead to, at the extreme, fatalities. And all of these things aren't really kind of considered in the in the calculus generally of folks. And yet what I've also found is when you begin with products, it's the lowest barrier for social norms and gender norms, right? Everybody can agree giving pads to girls, whatever kind or whatever menstrual products, is a good thing. And so then when you start to combine the reproductive health knowledge, and we showed this in our 2-year randomized controlled trial, the products plus the rights-based health education really transforms agency and self-determination. So 100% of the kids that were in our schools after COVID came back, boys and girls. And menstruation is something that can bring gender equality to boys as well. And so girls and boys go very quickly from saying girls have a right to play sports on their period and to have products to they have an equal right in the classroom and to share household chores, to mom shouldn't be beaten by dads or vice versa. So menstrual health is very much can be linked to education and gender equality, which really can help mitigate some of the climate risks. And that's a very complex, long chain, but I think it's one that needs to be talked about more and more because it's a real intersectional opportunity to open doors that are otherwise very much closed.
Thanks, Megan. I think that's so interesting to hear, really, for me about those kinds of cascading impacts that happen. That providing access or ensuring access to menstrual products is about so much more than just the product itself. It has those immediate benefits for health, but then it also has this ripple effect throughout all of society. And I think the other thing that I was really hearing from you was about the importance of listening to people who menstruate, right, and making sure that products are really responsive to their needs and that the products are responsive to the context that menstruation is happening in. I have one other question for you. You were talking about the importance of menstrual products for equity, and for gender equity specifically. Are there certain groups that are being more affected than others? Are there particular vulnerable groups who we might not be paying enough attention to within this space?
For menstruators, yeah, I mean, absolutely. I mean, frankly, any girl who is at the onset of puberty, right? I mean, when we started this work, I decided to work with adolescent girls, between 10 and 14, because that is when girls' worlds start to narrow, whereas boys' worlds start to widen. And that plays out with different vulnerabilities across different cultures. But I mean, even in the United States, there are only, I think, 4 states that don't allow child marriage, right? So girls are incredibly vulnerable when they don't know their rights and when they don't have the products to manage that with dignity, right? I think school going girls are very vulnerable, in that, especially when combined with a lack of education about menstruation. Um, they don't know what's going on and they don't know how to manage it and they have to figure it out. And we know that 20% of all sexual violence in Kenya is through motorcycle drivers, boated drivers. And a lot of that is girls because they are told that they'll just be given free rides and free pads, free rides to go to school. And they don't realize the cost that comes with that. And so I could point out specific cultures and practices, but I think that that moment in time is the most vulnerable. And climate change is just going to push more and more girls into more and more risk-taking behaviors as families have fewer and fewer options. Even in Kenya here, we've seen tons of school closures because of floods, and then also kids leaving because of droughts. We now have Ebola as a risk right now, and I'm sure there's a climate play there, and that ties directly to menstrual health as well in terms of risk. So, you know, that's my perception. Is I think it's the onset of puberty and girls' first periods and the degree to which that then narrows their world or allows their world to widen.
Thanks, Megan. Yeah, I think that it's so important to really hold on to and forward the needs of young people, especially because they're so often not in the room for these conversations and decisions that are being made. In this report, we have built in a couple of different sections that really highlight the importance of this intersection. So we have this one-page tear-out, which you can see on the screen in purple, that can be used for advocacy, as well as some guidance that kind of frames this topic and talks through some of the human impacts of climate change on menstrual health, which that's in our stories from the frontline section. Megan, I'm curious to hear what are something that, surprised you the most when you were reading this section of the report?
Um, yeah, well, first of all, it's been such a pleasure to be part of this journey with you all. And you all are doing such important work and advocacy in moving these issues forward. So I just want to say thank you. I could point out a ton of the stories, but I really want to encourage people to read them themselves. I think what was most helpful to me from a menstrual health climate perspective was the work that you all were able to do on documenting the carbon emissions impact, because that's something I've been really wanting to look at. And the challenge with products is that the more eco-friendly they are, the higher cost they are. And I think that being able to have these the climate emissions, like specific details broken down, you had them by every single different product in such a thoughtful formatting, can really be a step towards delinking the user and the payer, right? One thing I really aspire to as Zana Africa in the coming years is to be able to continue to sell our products on the market at the same price while making them more and more biodegradable, and figuring out how do we get that delta between what people can pay and what the true cost is underwritten by others. I think these are really powerful numbers. And I'm really hoping that those get more traction globally to help people who are looking at the climate really seeing this as a key opportunity where they can make their investments matter. And not just for menstrual products, but also all products that are similar, like diapers and adult diapers and stuff as well, because it only escalates there. But that to me was the most powerful work that was done. So that's what I would say.
Thanks so much, Megan. And that is such a great transition into our next section. So I really appreciate you chatting with all of us today about your experiences and sharing your expertise with all of us today.
Thank you.
With that, I'm going to go ahead and pass this over to my co-host, Nicole. Nicole, over to you.
Thanks so much, Bea. While the challenges are significant, they're not insurmountable. Around the world, innovators, advocates, researchers, and communities are developing solutions that are making menstrual health more resilient in the face of climate change. There are opportunities that exist across every stage of the product life cycle. So with that, next up, we have Tatiana Reyes-Hove, the outgoing COO of B-Girl. Tatiana, can you tell us what you've been building at B-Girl and what problem you're trying to solve?
Yes. Hi, Nicole. Thank you. So B-Girl is a women-led social enterprise working in menstrual health across emerging markets. And so we bring together three things: sustainable products, education, menstruation education, and data around, interventions. And the reason we work across all three is that menstrual health doesn't move forward on any one of them alone, right? So as we know, products meet an immediate daily need, education shifts knowledge, and just as importantly, narratives, and then stigma. And the data and evidence is what we can bring to governments and partners to make the case for investing in menstrual health. And so what we've learned over the years is how interconnected this all is. And I completely agree with something that Megan said earlier about sort of starting with products. And that was very much the B-Girl journey as well, right? We started with reusable menstrual products, but it was very product focus. And our mission hasn't changed, but how we contribute to this movement has changed as learning has evolved, right? Working with governments and partners on the ground. And so since 2014, we've reached over 500,000 young people and distributed more than 1 million reusable products across 36 countries. And so the thread through it all is that menstrual health only works when sort of we take a systems-based approach.
Agree, and incredible. Thanks for everything you do, Tatiana. And I honestly can't think of a better person to speak to the innovation section of this. So to that point, in your work and even more broadly in the space, what are some of the trade-offs that you feel like you've had to navigate between things like sustainability, user preference, and scale?
Yeah, this is such a loaded question. So the trade-off, and I've been at B-Girl for 9 years, and we were founded in 2014. So the trade-off we have been navigated most consistently is around this stigma that reusable products have. And this runs deeper than preference. And by the way, I agree with everything that Megan said. And I think I'm definitely building on this because we as a company, but I think in this space, we're all for product choice unequivocally. And we want women and girls to have options and the information to choose well. But the deck is stacked in a few different ways, right? So disposable pads became the standard in the US and Europe after World War I. And so modern got equated with disposable, and reusables got labeled as backward and inferior. So companies like ours, we started at a disadvantage, right? Working against a negative inherited perception. And the tension, as Megan mentioned, right, and then the report is very clear, is that the current standard reusable pad, right, just the one that is most prevalent, is also the most harmful to the environment, and the one that's also most affordable. And that popularity isn't really a free choice. It's shaped by what people can access and afford and what they've been told. And when women and girls have real access and good information and can afford it, many choose differently. And I know that I certainly did. And so it becomes a chicken or an egg problem, right? It's hard to scale better options without demand. And it's hard to build demand without access. And the good news is that, through my time at B Girl, things have gotten better over the years in this regard, especially with institutional partners who distribute products to girls in their programs. And that side has come a long way. Where there is still an uphill battle is on the commercial and retail side, right? When a woman or girl walks into a shop and chooses a product with her own money, that's where the stigma and the standards gaps, which I know was the previous one, but it's focused a lot on the report, and the tax treatment, which is the next one, and the perception issues hit the hardest. And a commercial market is exactly what a thriving menstrual market depends on, because we all know that, just distribution alone, right, through programs it doesn't make a market. And so to this, we add the greater structural barriers that the report lays out, that reusable products often fall outside the standards and classifications that exist for menstrual products. And I can tell you from our experience here at B Girl on the huge financial burden that this puts on businesses like ours, right? And that sometimes means that you can import, but you have to pay a very high tax rate. I've been in meetings with the Kenyan Revenue Authority in person, like it's very difficult. And so, or maybe sometimes in market we tried, like we simply couldn't sell our product. And so that's why our approach collectively, I think, has to be both bottom up and top down. So, yeah, bottom up is on the education, right? Showing women and girls that modern reusables aren't necessarily inferior and giving them the information and the options to choose. And then top down is advocating for the product standards and the policy changes and financing to make climate friendly, sustainable options more available. So that, these options are genuinely accessible and affordable and trusted. So that's the challenge.
Yeah. And just taking it back a moment, I mean, you bring up a big point around perception and verbiage, which is actually critical for go-to-market feasibility. In this space, sustainable can mean a lot of different things. So, I mean, how do you define sustainable in your B Girl practice?
So I think this is a challenge, right? Because it does mean a lot of things. And I think for us, it's for the products themselves, it means multi-use products. And at the moment, it means multi-use products. And that's what we've been working with over the past 13 years that we've been in existence is products that girls and women and girls can depend on for at least 2 years to manage their periods, and trying to make sure that the materials that we use are as highest quality and eco-friendly as we can make them, recognizing that we just have a lunch to cotton pad at the moment. But a lot of our other materials and fabrics are sports fabrics, and trying to do the best that we can there, for the same reason that there's just this inherent trade-off when it comes to materials and affordability.
Totally. So the report provides an overview of impacts and innovation opportunities that exist across the product lifecycle. And as Bea had mentioned, the report also includes 2 tear-out pages on the climate impacts and opportunities for the key products, as you see here on the screen. We've also outlined product-specific challenges for each product, noting that we see the impacts are concentrated upstream for single-use products, but downstream with reusables. So with that, Tatiana, one thing that I think the report does that is super useful as someone in the innovation space is highlight the different emerging innovations. So are there any emerging innovations that you are especially excited about right now?
Yes, two things, and they fit together. The first is product standards, and I know that's not necessarily the focus of this one, but I think that thinking about it as an innovation in this space is so critical, and the report does a really good job at outlining how important they are, because without them, good climate-friendly, sustainable products can't get certified or imported or trusted, right? So they just won't scale. And I think that that's why this work that you've done, through the Sanitation Hygiene Fund and RHCS, so it matters so much to this space. And the second piece is around materials. I think that's such an exciting, it's such an exciting time, and the real work to lower environmental impact is at the materials that we use. And so using plant-based or agricultural waste materials, or designing for products to be biodegradable is personally where I'm most excited to see where this innovation gets developed and how it gets commercialized. And the piece I would add here is that it can't stop at the lab. The challenge is going to come on the commercializing of these materials so that they can actually reach people. So to make them affordable and accessible. And sort of related to this, I think one last point on the innovation is that it requires time and patient capital, right? New materials, product development, and their commercialization. All of this takes time and money. And the actors innovating in this space, especially in LMICs like San Africa or like B-Roll, are social enterprises that continue to need this type of support. So, for example, one of B-Girl's key investors for about 10 years now is Grand Challenges Canada. And that kind of sustained investment is essential. So, when we talk about changing markets or expanding access, it doesn't happen in a 2-year grant cycle. We need long-term backing.
Totally.
So yeah, thank you.
I feel like we could chat about this for days here. Tatiana, thank you so much for joining us and sharing these insights. With that, I am going to pass this over to my co-host, Nomi. Nomi, over to you.
Great. Thank you so much, Nicole and Tatiana. Tatiana, I really appreciated how you were talking about kind of bottoms up and top down. That's a fantastic segue into this next section. And just reflecting on the chat and the insights that you shared from B-Girl and Megan shared from Zana Africa, it's really clear this isn't just about the products. Really, we're looking at learning much more about the understanding on the ground experiences of the impact of climate change on menstrual health from a whole person perspective. So just a huge thanks to both of you. So I'm really excited now. I'm going to zoom out. We've kind of gotten specific on products, and now we're zooming out in this last segment. And I'm really thrilled to introduce my friend and colleague, Ayman, who's B introduced him at the beginning. He's the chief of the Sexual Reproductive Health and Rights branch at UNFPA, based in Nairobi. Ayman and I have worked together, I don't know, Ayman, probably over a decade in the family planning and reproductive health space. And it's so great to have you here to talk about menstrual health. So let's get started with this segment. And Ayman, I'm going to start more at a macro level. So thinking about this from a systems perspective, what do you think is currently missing to support climate resilient menstrual health ecosystem at a broad level?
Thank you, Naomi, and good morning, afternoon, evening to all joining. I would like to start by thanking you, Naomi, and all the coordinating group and RHSC for raising this issue and keeping the baton for this very important topic. Because this is, unless you guys do this evidence-based advocacy process, we're never going to be able to change things. So to your point, Naomi, The first thing that I would like to highlight, and building on what colleagues have mentioned, Tatiana and Megan, colleagues, I would like to take us a step back to just to re-emphasize that menstrual health has to be seen and has to be supported as an essential and integral element of sexual and reproductive health and rights. We cannot separate the menstrual health from other elements of women's health. Accordingly, when we are talking about, if we build on this concept, we need to rely on robust health systems that will be able to deliver these fundamental rights. So menstrual health and the service of menstrual health and the commodities related to menstrual health needs to be part and parcel of the integrated package of services and commodities and supplies that we are providing to the women who need them. So because we need to make sure that these commodities are sustainable, this is where we need to be cognizant of how climate shocks and the disturbance can can affect the disruption of equitable access to these commodities. So when we try to look at what's currently missing to build a climate resilient menstrual health ecosystem, we need to look into two main dimensions: prioritization and supply chain diversification. Prioritization is number one. We need to look into how climate change is disrupting the health infrastructure and water access by the manufacturer of these menstrual products. Despite all of this, menstrual products are still routinely excluded from climate and disastrous response simply because they are fundamentally undervalued. And this is a very important element. And I can tell you from my past years as a gynecologist, menstrual health and the socio-economic, psychological impact of menstrual health on women's sense of being, women's sense of empowerment are extreme. And yet the systems are still undervaluing this. At UNFPA, we are relentlessly advocating for this change to make sure that menstrual supplies are critical life-saving necessities, are not just afterthoughts. So this is where we need to look into the other aspect, which is supply chains. We need to make sure that the supply chains are resilient to all the climate-related and all the disaster-related impact. We learned this the hard way, actually, during the COVID-19 pandemic, where most of our essential reproductive health commodities were brought from the Far East, either from India or China. And because of the COVID pandemic, most of these supply chains were completely disrupted and were put on hold. And many women were underserved to get their essential life-saving reproductive health commodities. I'm not only talking about menstrual health commodities, I'm talking about essential life-saving commodities that are essential for a safe delivery and a safe birth and a safe neonatal growth. So this is where a resilient supply chain mechanism is a cornerstone of what you're talking about. I have an example of what UNFPA is doing. For example, in Afghanistan, we are partnering with SafePad to supply our dignity kits through local women-owned and women-employing cooperative, which is very similar to what Tatiana and Megan have been mentioning a few moments ago. By shifting away from global suppliers to a localized model, while at the same time having the right policies and support, we bypass these international shipping bottlenecks while investing directly into an economic engines that empowers Afghan women. So you're having a double win-win-win-win situation. So I think what we're missing is a coordinated movement towards localized and regional manufacturing, as we just heard from Tatiana again and from Megan. And I think this will make us move forward in a direction where menstrual products are aligned with sustainable climate values and productivity. Back to you, Nomi.
Oh, thanks, Ivan. No, it's really interesting, and I'm glad that you mentioned the Afghan example. And I believe in the past you've talked about radical resilience in terms of the supply chains, and I love that. And it makes me curious with the kind of system levers that you just mentioned with supply chain and products and looking at these kind of resilient system pieces. I'm curious where you're seeing real momentum right now in terms of shifts in policy.
Very good point, Nomi. And again, very, very timely, especially with the release of this report. I personally, and I think if I may speak on behalf of UNFPA, we are really seeing momentum building rapidly at the intersection of evidence and advocacy. We have the evidence, we're generating the evidence. The report that you've just released today is a part of this evidence, and we need to convert this evidence into an evidence-based advocacy process. We know what needs to be to drive meaningful policy shifts, and we have the indisputable data. We need to start pushing on policy. So when we are talking about policy, we need to talk about policies that drive product transparency and improved standards. Earlier on, in the earlier days, multiple menstrual health manufacturers were never been required to disclose the chemical composition or the environmental footprint of the menstrual products they produce. This is now where there's more noise, there's more voice to make sure that these manufacturers are being held accountable to provide something that is sustainable from the climate point of view. And we've been hearing from Megan and Tatiana the movements in these directions and the innovative approaches that many and similar entities have been doing this. So the demand for this data is getting louder, and we are starting to work on putting the standards. And I will give you an example. UNFPA working together with UNICEF, UNHCR, and UNHCR, we introduced in 2020 quality standards that regulate the market for menstrual hygiene supplies. And we have been issuing technical specifications for 3 menstrual hygiene products like reusable menstrual cups, reusable menstrual pads, and disposable menstrual pads. So these standards, once enforced, I think is going to move the needle in a direction of a sustainable climate-friendly production process. The second point is we need to look into, and this is again where I see real traction in terms of momentum, is the fiscal policies and the extent of which countries and governments can issue policies that are conducive to and supportive of improved local production of these essential women's health products. So, for example, VAT exemptions, you can see that in Africa, for example, is actually leading the way on this. Kenya, and again, colleagues have spoken about Kenya in a very good way, is considered to be the first country to eliminate VAT on menstrual products and removing sales tax on tampons and sanitary pads, since 2004. So you see this good movement and you see this good momentum. The whole issue is we want to make sure that this momentum is sustainable and we can jointly achieve or push for a massive normative shift in the climate disaster response. So I'll give you back the floor. Over to you.
Thanks, Simon. And honestly, we could talk forever about this. It's so interesting to hear the examples. And I know that financing is such a key barrier. We are a little tight on time, so I'm going to ask Nicole to switch to the next slide. And you've talked about the supply chain, you've talked about financing, which again is, I think much more to say on that issue. It's with the decline of ODA, the demolition of USAID, I firsthand how challenging this is. And yet there are some opportunities for financing innovation that I know we've talked about. So I want to switch to the report and maybe you can pull back financing. But at the beginning, when you started talking, you talked about data and you've talked about kind of relentlessly working on advocacy. So we've got in the report some really exciting recommendations, but also a resource toolkit that includes a phenomenal report from UNFPA and a partner database that Bea is going to talk about it as we wrap up and just adjust a little bit, which is an opportunity for all of us, everybody on the call, to be part of this process and this movement. So, Ayman, just as we're wrapping up, when we think about data access and transparency, what recommendations from the report really resonate with you most that you'd like to share with folks today?
So, Nomi, to answer your question in a very summarized way, we need to work, when we are talking about advocacy, evidence-based advocacy, we need to work on changing the minds and the hearts of those who are allocating the resources. Because to provide conducive fiscal policies for essential reproductive health commodities and products, including menstrual health, is not an expenditure, it's an investment. And this is one thing that is highlighted significantly in the report. It is not a cost, it's an investment. And we are able to model the returns of these investments if and when these governments invest in this. And I think the report provides many of these recommendations that provides an outlook on the returns of these investments. So it is very important to influence these fiscal policies in a way that it changes instead of governments providing these tax exemptions, providing these VAT exemptions, supporting the local production of these essential menstrual health products. They're actually investing in climate and health related outcomes in the future. If we work on this, especially in light of the current fiscal environment, so the governments will start recognizing that it's not just a matter of donor funding getting reduced from one part. No, if I am seriously investing in the health of my women and young girls, if I really want to improve their labor, their contribution to my community and their empowerment, if I want to invest in sustainable climate-related policies, I can simply improve my fiscal policy that is supportive to local production and local supply chains and less reliance on global markets. So once we go into this line and using the findings of this report, the recommendations of this report, and keep hammering on this, I think we can achieve change. Over to you.
Thank you. No, and I'm with you. I think it's hearts and minds that need to change, but also collective movement and engagement. And that's such a great segue. We've really enjoyed hearing from you, Tatiana and Megan. And we also have a really impressive group of people on the line. I've been monitoring the chat here. So we've got about 10 more minutes before we wrap up. And we'd love to hear from our audience members if you have questions that you want to ask Ayman, Megan, Tatiana, any of us about the report or their comments. We're going to open it up to Q&A, and I'm going to turn it over to my co-host B to facilitate the Q&A. So Ayman, huge thank you. We're so grateful for your participation, for being part of the advisory group, and for all of your leadership in this space. B, over to you. Thanks.
Thanks, Nomi. And thank you so much to all of our speakers today. I'm excited that we have a little bit of time to chat. So if you have questions for any of our speakers about anything they shared or what came out in the report, please go ahead and put those in the chat. Okay, so I see this question from Tanya about the inclusion of the methodology for the calculations for carbon emissions. So, one thing that we included in the report was we have these product-specific tear-outs, which are 2 pages that look at the like each product type on its own, right? And thinking about where carbon emissions occur in that product's life cycle, as well as some of the important considerations about how to use that product or opportunities for innovating around that product. So we did include some carbon emissions for that particular product for each type. And what we did was we actually didn't calculate those ourselves. We used some of the existing research that's already out there. So the methodologies for those are included within the papers of the researchers who did those additional reports. So we've linked the sources for that data within the report itself, and you can kind of go back and look and see what they did there to make those calculations, which is really interesting and important, I think, to get into the details of some of the decisions that are made in that process, because you can see that, decisions that you make around about how many times a particular item can be used, about how many products are needed per cycle, with things like menstrual underwear, you're considering if you're going to be using it as regular underwear as well as menstrual underwear, or if you're only using it during menstruation. All of those things influence the final figures that you get. So I definitely encourage everyone to kind of look at some of those other resources that exist. The other important decision-making choice that we made when we put the emissions in was that we did choose to use the figures that were estimated for India specifically. So the paper that we drew from included estimates in France, the United States, and India. And in a lot of these conversations, we don't really see carbon emissions in low and middle income countries represented nearly as much. So we wanted to be able to forward those figures. What you do see is a lot of consistency in terms of, generally speaking, which products are higher impact versus which ones are lower impact across contexts. I see that there's also a question from Amelia about if we're seeing more innovative financing mechanisms being used to support menstrual health through impact bonds or other mechanisms. I'm wondering if this is something that one of our guest speakers is interested in talking to. I don't know if Iman, Tatiana, or even Nomi, if either of you have thoughts about trends in the space. Yeah, Iman, I see you came off mute. Go ahead.
Thank you, Bea, and this is a very good question. Maybe my answer will be a partial answer, not a complete answer, but I would like us to take into consideration that when we approach pooled financing mechanisms, we will have to approach it for an integrated set of women health related services and products. If I do this, if I adopt this approach, and when I try to approach the government, the stakeholders, the decision makers, the policy makers with an integrated package of essential women's health products, then I would be able to integrate women menstrual health and climate resilient menstrual health products within pooled financing mechanism. However, if I continue segregating as what's been done by the donors over the past many years, focusing on life-saving maternal health products, oxytocin, misoprostol, calcium gluconate, modern contraceptives, then menstrual health products will fall off the wagon. And this is the danger, and this is where we need not to go. So again, that's why I'm saying it's a partial answer. It has to be an integrated women's health set of services and products without alienating or eliminating menstrual health products simply because they are being seen as luxury products or something that is not necessary to be taken into consideration. Over.
Thanks, Iman. I think that's such a great point. I think especially because menstrual products, they just so often fall through the cracks because there's not one particular field or sector that holds responsibility for them, which it can be a limitation, right? It requires this really strong and vocal advocacy from all of us to keep them as part of the conversation. And it can also be such an opportunity because they span so many different sectors of work and can bring so many different people together, which I think is something that, Megan was really speaking to as well. From Paxton, I'm seeing a question about reusable pads as an alternative product. I'm wondering if Megan or Tatiana, if that's something that you would like to speak to. I'm not sure if Megan is still with us. She might have had to hop off.
Sorry, I'm absolutely here. My daughter got an ear infection, so I'm at the coast for 2 days longer and en route to the airport now. So sorry. I cannot see the comments, but I'm happy to, if you can prompt me, I'm happy to contribute.
That's perfect. Yeah, I will share that comment with you. And then Paxton, if you could just drop your email for me in a direct message, then I can share that. But one thing I will say about the reusable pads is that we do provide information in the guide. One of our tear outs is specifically focused on reusable pads. And so, it kind of talks about some of the considerations and limitations when it comes to using those products, in terms of how they're made, as well as some of the things to kind of think about when it comes to scaling up these products, right? Thinking through some of the benefits of reusable pads, and then kind of thinking about some of the challenges that kind of come with that in terms of thinking about how well they dry, access to resources for washing, and navigating, some of the challenges of scaling when we think about, this kind of very local product and how can we develop reusable pads that meet these high standards for product quality.
Okay. Do you want me to chime in quickly? Because I can see the chat now.
I think we're actually getting close to time.
No problem.
Yeah.
Okay.
But thank you so much. I appreciate that, Megan. So as we kind of wrap up for today, I just want to send another thank you to everybody who's joined us, to both all of our presenters and speakers, as well as all of you who have joined us to listen in to this really important conversation today. I think we've really heard a lot about the importance of centering users in these conversations, really recognizing choice as an anchor point for how we navigate this. And I think another really important thing that we have kind of seen in these conversations is also that you can't have these conversations about climate change and menstrual health without being really willing and eager to engage in a conversation about the practical realities, right? What are the limitations of these products? What are the needs and limitations of the context? What is happening with policy and financing, so that way we can really understand what it takes to set up an innovative product for success all the way through. I just wanted to highlight a couple of the recommendations that came out in our report, and you can find these in the report at the end. Keeping users at the center, really increasing transparency and access to data. Data gaps are a major challenge, right? What we know is growing, and there's still so much more that would be valuable for us to have and understand in order to really strengthen our advocacy in this space. We really want to encourage innovation at every single stage of the product life cycle, right? There is something that can be done to improve sustainability at every step from the very beginning of the raw components that go into the product all the way to the end at product disposal. We encourage folks to support scaling of these local and regional manufacturing processes to really improve access and think about, how can we address these barriers to scaling so that way innovative products can really get to market. And finally, we want to encourage everyone to really recognize the climate space as one that we in the menstrual health space are really prepared to engage in, kind of recognize both the kind of opportunities for climate mitigation and adaptation that exist within the menstrual health space, as well as realize what a valuable area of mobilization menstrual health can be for bringing folks to the table and developing innovative approaches that can really translate beyond menstrual health products themselves. There's one other thing that I would like to encourage everyone to do, which is registering to join RHSC's Climate Change and Menstrual Health database. So this database will be going live shortly. In the meantime, I want to encourage folks to register within our interest form. So I just put the link for that in the chat. We're building a database of groups and individuals who are taking action around climate change and menstrual health. So if you are anyone who is working in this space, we really encourage you to join, because we've really found through this process of developing this report that community is so important and valuable. And so we see this as a way to really build that community across everyone who's involved in this space. So please fill out this form. We will then email everyone who's completed that form once the database is live, and then you can complete a profile, which is going to be live and accessible on RHSC's website. So that way you can find other folks and other folks can find you. Okay, and finally, I just really want to take a moment to thank everybody for joining today, and thank you to the Reproductive Health Supplies Coalition for supporting this work. To review the report, we will put a link in the chat for where that is. And then there is also a link for joining our database. So that link is also in the chat. So I really appreciate all of you for joining, and really hope that you have a wonderful day. Thanks so much for your time. And good luck with all of your future work around climate change and menstrual health.
Thank you so much, everybody.
Thank you, everybody.